What could be described as a family's worst nightmare, a loved one who underwent surgery to amputate a leg wakes up to the realization that the wrong leg had been cut off. Newsforce has been following this development for weeks. However, officials have been mum and family members still stunned by the turn of events, reluctant to speak out publicly on the record, save for a one-off social media posting, which has since vanished. But health officials finally broke their silence on Tuesday, March 25th. According to Permanent Secretary in the Ministry of Health, Benson Emil, the wrongful amputation matter is now under investigation.
Well, yes, it's a situation that has been brought to the attention of the Ministry of Health and Wellness. And it's presently, the management of Okeu, they're undertaking, the necessary reviews and investigations. And thereafter, a decision will be made in terms of how we proceed. Well, it's expected that it's anticipated, that there are, legal recourse and ramifications for it. And at some point, our Attorney General, would be getting involved, in the process, so as to make the proper representation for the government here.
According to Emil, the family and the hospital have been in dialogue. Despite the horrendous blunder, the PS in the Ministry of Health sought to assure the public that the emergency facilities are safe.
Those incidents, may happen, from time to time. But, barring that, we trust, the clinical people at the hospital. We trust, the management at the hospital to deliver, proper care, to the population.
Executive Director of the Okeu, Nancy Francis, was on hand to offer sympathies to the family. She says the goal of the hospital remains to deliver first-rate treatment in meeting the needs of patients.
With reference to the matter under investigation as it relates to the amputation of a patient's leg, we have submitted a report to the PS of the Ministry of Health and Wellness for his action, and we have also met with the family, and we understand the pain the family are going through right now, and we empathize with them. We've reached out to them, and we are working to, as soon as possible, to address the situation. So the family, my concern is for the family at this time and the patient. We have to ensure that the patient gets the best quality of care, the patient is comfortable, and the quality of life of the patient is maintained.
Some quarters contend that the huge blunder has seemingly marred the image of the facility. The Okeu administrator says the hospital is no stranger to public criticism.
We received both negative and positive feedback with reference to the services available at the hospital and also the experiences of persons when they come to the hospital. Some of the feedback we received, what we've done, we take it and we look at it, we dissect it, and we try as much as possible to improve on what we do. Where we need to take disciplinary action, we do. Where we need to make recommendations to the Ministry of Health and Wellness for further action, we do. So we encourage the general public as much as possible to call us, to write to us, to email the hospital, and to let us know some of the challenges and the experiences they've had at the hospital, so we could see how we can continue to improve. Because it's a relatively new space we're in right now, the Okeu, and then we are trying as much as possible to give the best healthcare service at the hospital.
The $167 million Owen European Union Hospital was forced to open its doors in late March 2020 at the height of the COVID-19 virus, after the Victoria Hospital took on the role as a respiratory facility. Okeu Hospital is now the primary medical facility seeing to all manner of health-related issues. The Attorney General's chambers is reportedly gearing up to represent the hospital as, according to well-placed sources, the patient's family seeks legal recourse for the most unthinkable of mishaps in medical practice in St. Lucia. Solange Alfred, HTS News Force.